Hi everyone, and welcome to my presentation. My name is Dr. Shiva Hadadian, and today I'm going to talk about the causes of painful periods. I want to suggest some simple ways that help reduce your pain during your period. So let me share my slides. Okay. As you can see on the screen, our topic today is dysmenorrhea or painful periods. So, what is dysmenorrhea? Dysmenorrhea refers to frequent cramps and pains a woman may feel during her period. More than 50% of women have some pain for 1 or 2 days during their periods each month. Usually the pain is mild, but sometimes it is so severe that it interferes with their daily activity. Dysmenorrhea can be primary or secondary. Primary dysmenorrhea is a period of pain in the absence of pelvic pathology. The pain usually starts shortly before or at the onset of the menstrual period. Natural chemicals called prostaglandins cause this pain. Secondary dysmenorrhea is period pain that is caused by underlying pelvic pathologies such as endometriosis, fibroids, adenomyosis, and congenital anatomic abnormalities. In this condition, women start to experience more painful periods after years of normal period pain. The pain may begin a few days before a period. Dysmenorrhea symptoms may include cramping or pain in the lower abdomen, low back pain, pain spreading down the legs, and a feeling of pressure in the abdomen. For some women, severe pain comes with other symptoms, including weakness, fatigue, nausea, vomiting, diarrhea, and headache. Primary dysmenorrhea tends to lessen after the first few days of a period as the level of prostaglandins goes down. The periods also become less painful as women with primary dysmenorrhea get older. It also may improve after giving birth. However, secondary dysmenorrhea may get worse as the period continues and may not go away completely after the period ends. It also gets worse over time. Now it's time to talk about the risk factors of painful periods. While any woman can develop dysmenorrhea, women who smoke or drink alcohol are at an increased risk for this condition. Women who are overweight, women with depression or anxiety, women who started their periods before the age of 11, and women who have never been pregnant are also at greater risk of experiencing painful periods. Endometriosis is the most common cause of secondary dysmenorrhea. It's a disorder in which tissue that normally lines the uterus grows outside of the uterus. This tissue can be found on the ovaries, fallopian tubes, or intestine and breaks down and bleeds during the period and causes pain. Adhesions can also form inside the pelvic, where the bleeding occurs and cause pain. The fibroid is another cause of secondary dysmenorrhea. The uterus is lined with smooth muscle cells. Sometimes these cells grow out of control and a mass called fibroid or leiomyoma develop on the outside, inside, or in the wall of the uterus. Fibroids cause painful periods. Adenomyosis, pelvic inflammatory disease, endometrial polyp, and use of an intrauterine contraceptive device or IUD are other causes of secondary dysmenorrhea. If you have severe or unusual menstrual cramps that affect your daily activity and make you stay home from work or school, or when the onset and duration of pain suggests secondary dysmenorrhea, you should visit your doctor. A pelvic examination may be necessary for evaluating a painful period. Pelvic ultrasound should be considered if secondary dysmenorrhea is suspected. Patients who are at risk of sexually transmitted infection should have the appropriate swab taken. Diagnostic laparoscopy can help detect underlying conditions such as endometriosis, adhesion, ovarian cyst, or ectopic pregnancy. These simple strategies help you get rid of a painful period. 1. Change diet. Increasing protein and decreasing sugar and caffeine intake. 2. Using a heating pad or heating patch on the lower abdomen. 3. Taking a hot shower. 4. Abdominal massage. 5. Regular exercise. 6. Relaxation exercise for reducing stress. 7. Taking vitamin supplements such as vitamin E and vitamin B1. 8. Taking ginger through ginger tea, ginger candy, and ginger supplement. 9. Taking over-the-counter medication like Advil or Tylenol. 10. Taking hormonal birth control pills. Exercise helps relieve menstrual cramps because it causes beta endorphin, sometimes called human morphine, to be released. Walking, biking, yoga, stretching, and dancing are some types of exercise that ease period pain. Avoid high-intensity exercise such as intense running, lifting heavy weights, and squats during your period. It may increase your period pain. Now it's time to talk about the best supplements that help ease the period pain. Magnesium reduces menstrual discomfort. It works by relaxing the smooth muscle of the uterus and by reducing the prostaglandins that cause period pain. Try to increase your intake of this mineral from magnesium-rich foods, including soy products such as organic tofu, soy milk, and tempeh. Leafy green vegetables, particularly cooked spinach and Swiss chard. Cereals and grains, including quinoa and wheat germ. Pumpkin seeds, almonds, dried figs, and avocado. Dark chocolate and salmon. B vitamins can also be helpful in reducing period pain. Specifically, thiamine vitamin B1 and niacin vitamin B3 have been shown to reduce menstrual cramps. Green leafy vegetables, fortified cereals, oatmeals, grains, sunflower seeds, liver, mushrooms, tuna, salmon, and lentils are good sources of vitamin B. Anti-inflammatory action of omega-3 found in fish oil or flaxseed oil can relieve menstrual pain. Try to increase your intake of fish on a weekly basis. Choose wild-caught rather than farmed, or use flax oil drizzled on meals. Vitamin E supplements can reduce the severity and duration of period pain. The deficiency of vitamin E has been shown to increase prostaglandin E2, the inflammatory molecule responsible for painful periods. Wheat germ, sunflower seeds and oils, almonds, hazelnuts, and peanuts are high in vitamin E. Vitamin D metabolites reduce the production of prostaglandins in the uterine lining, leading to a reduction in the severity and frequency of menstrual pain. In women who are vitamin D deficient, prescribing supplemental D can help reduce menstrual cramps. Swordfish, salmon, eggs, and cod liver oil are good sources of vitamin D. The next question is, what sleeping position relieves menstrual cramps? Try rolling to your side and tucking in your arms and legs like a fetus. This position takes the pressure off your abdominal muscles and alleviates painful cramps. At this point, I'm sure you're curious to know which foods make period pain worse. Canned foods, beans, candies, caffeine, fried foods, milk, other dairy products, and fatty foods make menstrual cramps worse. And finally, what medication reduces menstrual cramps? Your healthcare provider may recommend over-the-counter pain relievers such as ibuprofen or naproxen or oral birth control pills to reduce the severity of your pain. If your pain is caused by a disorder such as fibroids or endometriosis, surgery may be recommended. Thank you for your attention.